The majority of the lab testing that conventional doctors do is to figure out which medications they can give you.
Right.
Right. So when the lab work we do, we're doing a very deep dive into figuring out what's going on inside your cells and what do your cells need to function better. So we go quarter by quarter, adjusting and shifting the plan based on goals, based on lab work, based on what we're trying to address. So every 90 days, the body gives plenty of time for things to change and to adjust and to heal. And then we have a different picture. And then we take the next step, the next step, the next step.
Welcome to another episode of You Must Be Out of Your Mind. I'm Dr. Don Wood, and today I have Dr. J. And I want to introduce Dr. J. I met him through some colleagues, and we were on a panel together and sort of hit it off. And then you showed up at our facility on vacation, and we're sort of going to go from there. So welcome to You Must Be Out of Your Mind.
Yeah, I'm glad to be here. And I definitely feel like I'm out of my mind all the time. So it's a perfect fit.
Everybody says that's awesome because it's such a great introduction. So Dr. J, as I'm going to call you, is a naturopath, right? So you do a lot of natural medicine. So tell us a little bit about what you do and how you help people.
Yeah. And it might be different because, of course, some people think natural medicine and they think, oh, it's essential oils and herbs and all those things. But really at the root cause of natural medicine is getting to the root cause. And so that's what we do is we figure out what is the root cause of what's going on in your body and then work to optimize that. And being a naturopath, I have lots of tools. Conventional medicine, they have basically two tools. Either they'll give you a pill or they'll do surgery for you. But as a naturopath, we do have herbs, we do have vitamins, we do have minerals, we do have peptides, hormones, a whole, medications if we need. And so we have a whole range of tools in the toolbox to work to optimize. And so that's what we do, is get to that root cause of the person's issue of whether it's low energy or lack of focus or low performance, and then work to build their body up, build the foundations of health. And then from there, once we build that up, then that's where I like to get fancy too and increase performance and add in new stuff with longevity and anti-aging. And there's definitely it's really a fun time in science and the medical world right now with where those things are going.
Well, on the panel that we were on when we were out in Phoenix, you talked about being able to live a lot longer. So what's your belief on how long we can live?
Yeah. So I believe that there are people alive today that are going to live to be 200 years old and be healthy during that whole time and healthy, performing, active adults. I don't think that today we have that technology, but I do think today we have the technology that's going to help people live another 20, 30 years. So in 20, 30 years, when we have that technology, is going to be able to help people to add that 50 to 100 more years to their life. So yeah, so when I'm working with clients, I tell them, hey, you better plan on working with me for the next 100 years because that's what we're going to make happen.
So what do we need to do that? Like, what's the secret? How do we do it?
Some of it we don't know yet, but we will learn. I'm confident in the next, like I said, 20, 30 years, the rate of technological advancements are going to be there. But we do know a lot. And so a lot of times when I'm talking to people, I talk about there's a normal aging curve. And so people are on that curve. So basically you peak in your health somewhere around your 20s and 30s, and then it's a slow decline since then. And then average life expectancy is mid 70s, a little bit less for men, a little bit more for women with that. And so, especially those last years in kind of the conventional thinking, the quality of life is really low. And that's the normal aging curve. And if we wanted to add a little more years to that, there's what I call healthy aging. And that's just the basics of eating right and exercising and just doing a little bit more, better than the average person. And there's people that are doing this already, people that are already active and healthy, that just for whatever reason they live 10 years longer. They might be the same age as someone, but they can hit the golf ball further, or they just function a little bit better. But so that's the healthy aging curve. And then the next level beyond that is what I call anti-aging medicine and performance medicine. And that's where we get more of a deep dive into you, into your health. And we do even more nutritional supplementation and building up. We're adding in hormone therapies, we're adding in peptide therapies, we're adding in stem cell therapies. And that's when we can really start reversing that aging curve and helping people feel younger and perform better. And there's a lot of new testing that's out in our modern world. And so we can do some of those tests and then from there figure out what the body needs to reverse those signs of aging. And so that's that extra third kind of aging curve where we're able to add years and add performance and add function and help people feel better. And then there's the fourth, which is the future one, where people that are on that higher curve, we can then help them take and extend even more years that has come on.
It's so fascinating, like 20, 30 years ago, if you had started talking about that, they would have said you're crazy as science fiction, right?
Right.
We actually can see it now, right? Like you're saying that you can see where we're going and the progression we've made, and that there's a lot more to learn. So what we're really doing is slowing the aging process down. Would that be a great way of sort of explaining it?
Yeah, for sure. And also it depends where you are. Some people that there's a lot going on, we feel like we can reverse damage, reverse problems. But overall, we want to slow that down. There's some tests that are out there now, which are not my favorite because I still feel like they need to be vetted out a little bit. But they'll give you like a rate of how much you're aging. And so if your score is less than 1 year, then that means you're slowing down that aging process. You're only aging, you know, point 0.8 in a 1 year chronological time. And so, yeah, that's the goal, is to be able to do that, slow that aging process. But then even like I said, there's a lot of opportunity to reverse some of the damage that's there. And so we might not be able to get your body functioning back like it did when it was 20, but we can get you, you know, significantly higher functioning than you might have if you're on a normal unhealthy aging curve.
Yeah, because that's that I see a lot too. Is when I work with people, I'm working more with the brain, right, which also affects the body. But I'm seeing that, in particular, childhood trauma has a major effect, and that will age you a lot quicker. And then also just regular day to day stress. So you've seen a lot of stress having a big effect on the way people are aging.
Yeah, for sure. And really, stress is such a broad term. Yes, everything is stress. Inflammation is stress. Past trauma is stress. And, you know, the disagreement with your spouse is stress. Raising kids is stressful. Going to work is stressful. But also, so is eating bad foods. So is eating processed foods. So is all those things. They're all stress. And the body it's not able to discern between what stresses there are. It just knows that it's stress. And so that's why if there's one big major trigger of those stressful events and gets you out of your normal functioning, it can have a big effect. But yeah, I think 90%, maybe 95% of all the accelerated aging and problems are tied back to stress on some level.
Yeah. Yeah, that's what I say as well. I think 80% of all the illnesses we're seeing are psychological based,
Right.
and 20% are physical,
Yeah.
which we could deal with a lot better if we knew what we were dealing with. That's why I think what you're doing, Dr. J, is the future of medicine. Traditional approach of what we've been doing up to this point really has not been it's managed it, but it's not fixing it. And
Right.
my wife is a great example because she had trauma in her childhood, a very violent father, a lot of issues. And she says, at no point did she ever, in any examination by a doctor, get asked if she'd had trauma. And yet that was the major issue that she was dealing with. But they just dealt with the symptoms of it. Are you finding that as well?
Yeah, that is the big problem, and that's why people are so kind of disillusioned and so frustrated with conventional medicine, is because they just chase symptoms around like it's whack-a-mole, and like it's a game at the fair. You know, a symptom pops up, let's just whack it. Another symptom pops up, oh, let's just throw a pill at that, throw a pill at that, throw a pill at that, or throw even a surgery. A surgery is just a big whack-a-mole mallet in a lot of cases. I talked with a guy just on Monday, and he's on his fourth bypass coming up soon, bypass surgery, and he's still crazy out of control diabetic. His like blood sugar's out of control, blood pressure out of control. He's worried about cholesterol. I'm less worried about his cholesterol. I'm more worried about all those things that are causing that. And I'm talking with him, like just listening to him, like this guy just has trauma after trauma after trauma, which puts him in a state where he's not willing to take care of himself. And
Yep.
so, yeah, it definitely all adds up and leads to people where, you know, mentally and emotionally they can't handle the situation, and so they're relying on pills or alcohol or something to cover those symptoms up, and then things get so bad that it's really hard to work to reverse that physiologically on top of that.
Yeah. I talk about walking around with a 165-pound backpack of trauma,
Yeah,
right? That's gonna wear the system down. You're not designed to carry that extra weight, and that's gonna have, a major influence on your bones, on everything in your system. So if we can get that 165-pound backpack on, it's gonna make what you do so much more effective. So that's no, I'm excited about working with you because I know we can do a lot of really great things together, dealing with the trauma and then dealing with all the physical things.
no, I'm excited about it too. And you know, the guy that I talked to yesterday, you know, basically every question I had, he kept referring back to that 165-pound backpack. And whether it was his disagreement with his wife or this business partner that did this, whatever, all those traumas have just added up and he's still carrying them around. And, you know, like I basically told him, I'm like, you have 2 years that you can live miserably, or You can do something completely different and live 30 years in a healthy way if you want to. And surprisingly, he's like, I need to think about it. It's going to be hard for him to get that 165-pound backpack off with the trauma and things that he's going through. So yeah, hopefully he'll make the decision that's best for him. So
Well, I find it what it comes down to is identity. They start identifying that that's who they are. And so they pick up all of those things and they've lived with them for so long that, if I'd walked for 20 years with a sprained ankle and you told me you could fix my ankle, I'd say, I think I'm okay. I've been walking for 20 years with it. It's not really bothering me. It's just you've gotten used to dealing with it. And that's where they sometimes struggle with why do they want to come in? They're okay,
yeah,
but don't know what healthy feels like anymore. If
yeah.
they don't know what healthy feels like, and somebody comes along and says, I can make you healthy, they don't know what that would be. In that kind of a situation with this guy, because we're not telling his name or anything, what would you have suggested he do?
Yeah. Well, first off, there's of course a time and a place for conventional medicine, but basically the first thing is he would need to stop listening to the conventional doctors. And I'm not saying he's on 10 different medications or whatever, something crazy. I'm not saying stop those medications, but he needs to look at the source of his information. I love conventional medicine. My wife had a kidney transplant. Conventional medicine has saved her life many, many times. So I love conventional medicine. But when it comes to someone like a diabetic, they don't do a very good job. And so basically then we would need to change his eating habits, change his sleeping patterns, change his exercise patterns. And then from there, once we've removed those obstacles, and they're just a few basic ones to start out with, he would start to see progress. And then from there, his blood pressure is going to naturally start to drop. And so he's going to start lowering his blood pressure medicine. His blood sugars are going to start to improve. So he's going to start lowering his blood sugar medicines. And everyone's different. But I've had guys in much worse situations than him where within 6 months or within a year, we're able to eliminate completely or at least cut them down significantly on the medications that he's on. And it's listening to the body in a way that's actually productive rather than just trying to cover up the symptoms that we're seeing is what that process would be.
I see people and they don't eat right, they don't really take care of themselves, but they're not having the problems that other people are. And the other people will say, well, that guy eats way worse and he does all these different things. But if he doesn't have some of the stress in his life, his system, not that it's good, but his system can handle it better. But if you've got all the stress and all the trauma in your life and you're doing all of those things, it's going to speed everything up. And then all of a sudden, you're almost 20 years older than that person physiologically.
That's absolutely the case. And, they're built into that. Your stresses and your traumas, of course, are there, but there's your genetics, your genetic foundation. And also, it's very underrated. What was your food quality when you were in the first 20 years of your life? If
Yep.
you grew up on a farm where you had good, high quality, healthy foods, you're going to be able to live longer than someone who grew up in a city and was eating Cheerios their whole life. And so that's a big factor in there too. But yeah, and it adds up. Every day, your choices add up to where you are in that day.
And it's just an accumulation kind of a thing, right? So it just keeps building and building. And then you get to a point where it's very difficult to reverse, but it can be reversed.
Right.
It's just going to take more effort and
Right.
big changes.
Yeah. And one other thing to be aware of is just because they might look good on the outside doesn't mean inside they aren't even just as sick as that other person. They might on the outside look 20 years younger, but they might be, a couple weeks away from a heart attack or something. And so there's a lot going on inside the body too. And your body's really good at compensating and covering up. Like there's high functioning, super major, people PTSD and things, but inside they're just a mess mentally, emotionally as well. And so that's a big factor too. You can't be deceived by what's on the outside. You gotta look what's on the inside.
Yeah. Yeah, absolutely. And like I said, so we deal with a lot of people with trauma. And once you eliminate that trauma, everything starts to change. So a lot of times people will say, like you just mentioned genetics. And I say, well, it depends on when you measure the genetics. If you measure the genetics after the trauma, you're going to say, oh, it's the genetics that caused it. But maybe the genetics were just a symptom of the problem because, as we know, they turn on and off.
Right.
And so all of a sudden people say, oh, there's the problem. It's this gene, this gene, this gene. Well, yeah, because those genes turned off because of the trauma. So
Right.
we know certain genes that we've identified that once we resolve the trauma, those genes will turn back on and start doing what they're supposed to do.
You explained that so well, and people don't understand that because people just think, "Oh, I'm going to do this genetic test. It's very trendy right now, medicine. Do a genetic test and get all your questions answered." but that's really not what's happening. And even the food you ate for breakfast is going to turn on genes or turn off genes. The thoughts in your mind are going to turn on genes or turn off genes. And from there, then, and those genes create peptides and they create messages. There's things that are happening in the body based on all of that. And people don't realize how, how just generic of a blueprint the genes are and how similar all of our genes are. 99.999% of our genes are the same. It's just what are our choices that are doing that are turning them on or turning them off. If genetics was the master cure all, like they said it would, when back in 2000, 1998, when they first sequenced the human genome, they would have solved all disease problems. But we have even worse conditions now.
Yep, that's so true. So, yeah, people don't understand that. So it's everything is when you're measuring it. So if you've had childhood trauma and you start measuring it now, you're going to see a whole bunch of different things. Well, those may be all symptoms.
Yep.
So both you and I got into this because of personal issues, right? So your wife and my daughter ended up with 2 autoimmune disorders that we resolved, but both those autoimmunes were affecting her entire system. So tell us about what got you into this with your wife.
Yeah. And so on the genetic topic, there are some genetic conditions. Like my wife has a genetic condition where 100% of the people that have those genes develop a condition.
Yep,
And
that's
those
at
those are
20%, right?
yeah, those are the ones. She has polycystic kidneys, which means her kidneys just genetically formed lots of cysts and got really, really big. And so a kidney is normally the size of your hand. Hers got to be the size of gallon jugs of milk, 2 of them inside
Right.
her. And then also filled with infection, with pus and different things. It was lots of ups and downs, and she was a lot sicker than we realized. In fact, on our honeymoon, she was super sick the whole time. In our first year of marriage, she was in the hospital 4 times with all these kidney things that were coming up. And because your kidneys are responsible for being one of the major filters for everything that's going in your body. If you have one organ system that starts to fail, it's going to affect all of you. You're only as strong as your weakest organ system. So going through that process, and we didn't need to go on all the details. We spent way too many days in the hospital, way too long. Her doctors thought we were going to lose her too many times. By some miracle, we have 2 amazing daughters that made it through the process. It's not fun to be pregnant with giant kidneys while you have a baby that's headbutting and kicking your kidneys the whole time. Anyway, so she survived. I say survived because especially after the second one, there was major complications after the birth, and I almost was left with a 2-week-old and a 3-year-old. But she's such a fighter that she made it through. And then through that process, of course, I learned the amazing benefits of conventional medicine. Even though I went to naturopathic medical school, I was doing rotations in the hospital, which no other naturopath I know was doing rotations in the hospital, because I knew conventional
Right.
doctors that were in the hospital. And so being able to see that process. And then also, as I talked to it, learn the value of prevention. Because aside from those genetic conditions, like when I was working with her nephrologist, and doing the rotations with him when I was in medical school, 99% of the people he saw were there because of issues that were 100% controllable by their choices, due to their blood sugars or due to what they're eating, their activity, their things that were leading to high blood pressure or different things that were causing their kidneys to fail, or autoimmune things that they just weren't taking control of. Some of them are easier than others to take care of. But what drove me crazy and blew my mind is those conventional doctors would never ever think of referring someone to a naturopath or a doctor like me that's going to reverse those conditions. No,
Right.
they will continually forever just give them the pills to cover up the symptoms. And but yeah, and that led us to kind of where we are today through that journey, and me trying to do the best for myself, make sure that I can function my best, which I was not taking care of myself like I needed to during the time, especially when she was the sickest. Yeah, but now we're doing better and just working to get better every day.
And she's doing much better, right?
So yeah, it's been 5 years since her transplant. She's always the 1 in a million. I feel like she's 1 in a million for me specifically, but she's
Right.
also the 1 in a million with all the medical books. So basically, every problem that you could have with a transplanted kidney, she has had, but it's still functioning pretty well. She just texted me her numbers from her recent labs. She's visiting her kidney doctor this morning, and her kidney function is still doing well. Her immune system is on kidney transplant medicines. Your immune system does not function like it should, because we got to make sure your body doesn't attack the transplanted kidney. And so she's definitely prone to infections. And so every now and then we have to go down to the hospital and spend some time there getting some IV antibiotics or different things that come up. But overall, she's definitely doing much better.
That's great. Well, she's lucky she had you too. So, I mean, your mission was to try to find answers, and not everybody has that. And so many times I see, and I feel bad for parents because they'll come in and they'll tell me that they've they've tried everything. They've gone to everybody, they've tried to see everything, and nothing has really worked. And I feel bad for them because there really aren't a lot of answers in conventional medicine for certain things,
Right.
and yet they'll still attempt it and
Yeah.
try to manage it,
Yep.
and yet they don't really manage it very well.
Yeah. Oh, for sure. When we got married, with using my wife as an example, she was on 7 different medications every day. That first year was kind of rough. Even by the end of that first year, though, we were still able to get her off of all of her medicines,
That's
her conventional medications. And she's feeling better than she ever had before. There was the the kidney stuff that was not preventable or changeable by the things we were doing that added up over time. But she had multiple years of her life actually not on medication for the first time. She was on some medications every day of her life since she was like 4 years old. Which
wow.
and her parents, like you said, they were just trying to do their best,
Yeah.
and that's just what the doctors, the experts told them that they needed to do for her, and they didn't know any different. And so that same thing happens for most other people. They go, to the doctor because they're supposed to, and they find out their blood sugars are high, and they get put on metformin, or they find out their blood pressure's high, and they get put on a blood pressure medicine, and they don't realize that there's other options, and they're not even given other options to do something different.
And there's really no great answers out there. Plus, they put a lot of restrictions on what you can put out there. I mean, you probably have the same issue we do. If you say certain things, you got to be careful because they're gonna shut it down. Do you have that kind of an issue as well?
So I am lucky in the fact that being a naturopath, I report to the Naturopathic board, and the Naturopathic board is much more open to me saying what I say out there. But I have some friends that are they're DOs or they're MDs, and they want to do more of a functional anti-aging longevity approach, and they have problems, and they have to. I've had multiple friends actually give up their license so they can keep doing what they're doing and helping people without having to try to fight the system that they're in. So it's tough, but it's a real thing. A lot of those messaging from doctors is very, very controlled. So I'm lucky and that I found naturopathic medicine when I did to be able to be confident and to not have to give up my license, to be able to say what I want to say.
Yeah, that's amazing. And COVID comes along, and in one sense, I look at COVID as being a benefit. At the first time, it started off as not a benefit. Now I think it's become a benefit because I think for the first time, people are now questioning, right? And saying, you know what? I don't think we were told all the answers. These people may not have all the answers because they always thought of them as, well, they're a doctor, they must know, right? And
Right.
what we've learned is, even in our profession, we're still learning what's going to work, what's not going to work. But I think it did help us with COVID and opening up a lot more opportunities.
Yeah, you're absolutely right. It definitely shed some light on the system and showed where there's some chinks in that armor with the system. And in the doctor world, like those medical boards were very strict on the messaging that you could say online and different things. The naturopathic board, they gave us some guidelines. They told us not to say things, but then they never pursued anyone if they were still being out there and talking and different things. Yeah, luckily in our office, we're in Arizona, so if there's a little bit more leeway compared to some other states. Like Florida also was pretty good.
That
Like
was
we never wore masks. I never wore a mask in my office, except for there was one time one client asked me to wear a mask, and the whole
right.
time. And so I was signing vaccine exemptions to any of my clients that wanted to. And really, my whole thing was just like, where is the data? Let's show the data that shows that this is going to be beneficial. And anyway, now that the data has come out, and if someone wants to dive down the rabbit hole, if you're not aware of that, that's definitely a big rabbit hole. The data is all out there now. So
It is. It is. It just never made any sense to me. What they were saying is you need to get, because I never got vaccinated.
right,
And I was traveling, seeing people doing everything the same way. But people were saying, well, if you don't get the vaccine, you're putting other people at risk. And I said, well, what other people am I putting at risk? Well, people, who got vaccinated. Well, how could they be at risk if they got vaccinated? So that doesn't make sense. They got vaccinated to protect them against people who don't want to get vaccinated. But if I don't get vaccinated, how could I hurt them?
right, yeah. And one of my things that I had is looking at the size of a virus versus the size of the openings in those masks. I'd be like, okay, so what I'm going to do is I'm going to get tennis balls and start throwing tennis balls at you, and your job is to catch it with a hula hoop, right?
Right.
Because that's what the size differences was of this virus particle is this size, the hula hoop hole in the mask is this size. How is that mask going to be effective? And anyway, that was just one of the things that I used along the way too, for to combat those same type of those dogmas or the sayings that were coming out for the conventional medicine on the conventional things. So
Yeah, I mean, my wife and I would go to restaurants, right? And you'd had to have the mask on because even in Florida for a while, they were pretty
Yeah,
strict on it. And I was like, I can smell everything being cooked in this restaurant. How is it stopping anything from getting in? I
yeah,
mean, if I could not smell anything, I would say, well, it's probably effective. But
yep,
that
yep,
again, there was just so many things that weren't right. And I sort of get it in one sense, is that they were in a panic situation. They had to move quickly. Right, but at the same time, there was a lot of misinformation more on their side than the other side.
yeah. And really that same misinformation is happening kind of across the board in conventional medicine, because the money has controlled the messaging for so long, even down to, like I mentioned, cholesterol before with that guy we are talking about. The foundation that cholesterol causes heart disease has just been totally debunked, even in the cardiovascular journals, kind of in the best places. It's all still super published. Cholesterol doesn't cause heart disease, yet every single person who goes to their conventional doctor, if their LDL is high, they're going to talk about putting them on a statin, which is just crazy. So, I mean, that's the same exact thing that we just talked about with the COVID information is happening with cholesterol. It's happening with blood sugar, all these conditions all the time.
And they constantly change. So I did a scan. I was up in Philadelphia and I worked with a gentleman and I did a scan on him before the session and it showed he had high cholesterol, LDL cholesterol. He goes, how does this thing know I have high cholesterol? You didn't take any blood. Right. And I said, well, cholesterol is like a frequency, so it's high. And he said, but you didn't take any blood. And I said, no. I said, I can't tell you the exact amount it is, but I can tell you it's high.
Yeah,
Well, I take him through the process and I retest him and it's gone back into balance. And he says to me, he goes, well, that doesn't make any sense. You tell me my cholesterol changed in like 4 hours? And I said, yeah, it did. So your situation is able to fluctuate. Once we get the stress out, right, then that LDL cholesterol is being synthesized, right? As long as it's not feeling the mind's not feeling safe, it's not going to do that maintenance job.
yeah, yeah. No, and the body is so amazing, and then this is as kind of my root of what going back to being a naturopath. Like I am a 100% believer the body wants to be healthy. We just got to
Yes.
remove all the things that we're doing, whether it's the trauma or the food or the choices or all the things that are preventing our bodies from being healthy and optimized. And so, yeah,
Yeah.
like you just shared that perfect example. You just removed some of those obstacles. The body's automatically going to start to be healthier.
And it changes that fast,
Yeah.
right? So it instantly starts doing its job. Because what I always talk about, as long as you're being chased by a lion, your system's not going to do maintenance. It's going to do low maintenance because it's focused on survival. So all the things that your body can do, it temporarily stops doing until it escapes the threat. But the problem is trauma keeps looping and running. So it keeps the threat active and then the maintenance doesn't happen. And then we're in there trying to patch up all the damage that's being done because the maintenance isn't getting done. Yeah.
Yeah, that is so key. I because we actually do like the saliva cortisol test. So we see people's saliva curves during the day and see where their cortisol patterns run. And I have clients that I work with that they are 24/7 always in stressed out mode. Whether it's a lot of times it is trauma and capital
Yep.
T trauma, smaller T trauma, but sometimes the way that people are, I work with a lot of business owners, the way that they're running their business is basically running their life and controlling their cortisol levels too. So
Yeah. So they're dealing with that on a constant basis. Then you add in trauma,
yeah,
right? Unresolved trauma. So if you get the unresolved trauma taken care of, the day-to-day stress they can handle a lot better. And
yeah.
then everything that you're doing is going to improve it because then the maintenance accelerates, which is exactly what you're talking about.
That's where we love to come in. And once we get that calmed down and get them out of that stress mode, that's kind of where we excel in building that foundation of health. You can measure your deficiency in these certain nutrients, these specific building blocks that your body needs. We supplement with those to overcome those deficiencies and optimize hormones and optimize other functionings happening in the body. And people are surprised at how good they can feel in such a short period of time.
What do you typically see when people come in? Like, what's the majority of the stuff that you're dealing with?
Yeah. So for the first decade of my doctor career, I ran programs to reverse diabetes and reverse heart disease. And so most of the people coming in, they had a lot of things going on, a lot of medications on insulin for multiple years. And still we do that same process and find out what those obstacles were and help them to be able to reverse those conditions and get off their medications in a short period of time. I did get a little burnt out working with those groups of people that had a lot going on and a little bit frustrated because we would do amazing work over a year and they would be transformed physically. and they'd finish the program and go right back to where they were before. Because we weren't addressing trauma correctly, and so they're probably that trauma pulled them back in
Yep.
with what we're doing. And so then I had a group of clients that were business owners and entrepreneurs, and younger and hadn't quite developed all those things. They might have been pre-diabetic or just started to show the signs of blood pressure being elevated, things like that. And so I started running the same program with them, and they would feel super amazing. We would reverse their prediabetes, reverse their start of high blood pressure, and they would function better, perform better, and show up better as a business owner, different things. And that kind of led to me meeting some higher level entrepreneurs and even higher level entrepreneurs. And then they were all referring more and more people. So basically, right now, we work with business owners. And it works good too because business owners have a growth mindset generally. And so then they can take that growth mindset and apply that to their health. And so they realize the things that we're doing is really beneficial. And I have a business owner who's 31 years old and has perfect blood pressure and maybe a little bit high blood sugars and different things. So we have a huge spectrum kind of across the board on the conditions we treat, but it's all about finding those people that have the right growth mindset that are going to want to put forth effort and make the changes. And those are the people that we can make those drastic changes and get them on those different aging curves like we talked about earlier.
Well, the key is getting them to want to get the help, right? And
Right.
follow the program, right? So if they do, then it just works, right? And
Absolutely.
people say to us all the time is like, well, how do I know it's going to work? And I said, because it's science. Science
Yeah.
works. Just follow
Yep.
the science, right?
Absolutely.
Yeah. So when you're dealing with somebody and they come in, right, what's the process that you take them through? Like, tell me from beginning to end.
I'm all about, talking about science. We actually want to look at data. And we do very different lab testing compared to conventional doctors. I've said good things about conventional doctors and some not good things about conventional doctors. The majority of the lab testing that conventional doctors do is to figure out which medications they can give you.
Right.
All right. So when the lab work we do, we're doing a very deep dive into figuring out what's going on inside your cells and what do your cells need to function better. And so our lab work is very different and very extensive. Instead of looking at 20 markers, we're looking at 200 markers, 200 plus markers. And then we build a custom plan. So we build out nutrition plan, supplement plan, hormone optimization plan, peptide therapy plan, and then also plan to address any of those issues we find. Because generally, without a doubt, we find insulin resistance, leaky gut, other kind of more chronic underlying issues that are feeding inflammation and feeding damage to the body. And then we build a plan to reverse those and reverse the insulin resistance, reverse and heal the leaky gut, the hormones and all those things. And they start feeling better slowly but surely. And then they add more fancy things in, like we talked about with peptide therapies and longevity and anti-aging stuff down the line. And then we basically go quarter by quarter. You asked what is it like working with us? So we go quarter by quarter, adjusting and shifting the plan based on goals, based on lab work, based on what we're trying to address. So every 90 days, the body gives plenty of time for things to change and to adjust and to heal. And then we have a different picture. And then we take the next step, the next step, the next step, quarter by quarter.
Awesome. If people follow the plan just works, right? And so most people don't understand their body to begin with. And so they just need somebody to get in there and give them the information and just follow the plan.
Like I said, we work with a lot of business owners. And so the business owners have their P&L for their business and look at all the KPIs and the numbers. And so I'm like, well, that's what we do for your health. And so you hire us to be your chief medical officer. We analyze all the data and then tell you what the next steps are. Just like if you had a chief marketing officer, they would look at all the data and tell us, okay, this is what we need to do for marketing or XYZ, or, just like, you have those roles in your business. So you don't need to be the expert on medical. We just tell you what to do.
What's smart about what you're doing too is working with business owners. I love working with business owners and athletes because they're generally the more disciplined people, right? So when you tell an athlete or you tell a business owner, this is what you need to do to have a successful business, the people who have been successful know they have to follow it, right? There's no luck or magic to most success, whether it's in health or business. It really comes down to following a really good game plan.
Yeah. Oh, you're right. Because if you don't have that right mindset, then that's why you're looking for that magic pill that conventional medicine promises. That's why the blood pressure medicine looks so appealing because, does that blood pressure pill lower your blood pressure? Yes. But is it addressing the reason why the blood pressure is high? No. And so that's what we work to address. And so the athletes, the business owners, they realize that step-by-step process is necessary for success. There's never a magic pill. There's never a magic pill in business. There's never a magic pill in athletics. And so they had that mindset already. So you're right.
Yeah. And they know how to work hard and they're
Yeah.
not afraid of hard work. And that's the big thing where you get somebody who's just never had to go through those tough times to get through those days when it doesn't feel like it's going to work. They just got to keep plowing on. Entrepreneurs and athletes tend to be those people that can do that. So I know we got some exciting news coming up. We're going to be doing an event together.
Yep.
So tell us a little bit about what you're looking forward to.
Oh, yeah, I'm so excited because I remember, like you mentioned, we were on that panel at that event here in Phoenix a couple months ago, and everything you were saying sounded like I was saying the same thing. But we're coming at it from two totally different perspectives. Like you said, you're coming from the trauma, the nervous system balancing out all that side of things, and I'm more of the kind of the physiological kind of root cause naturopathic approach on the more physical side of things, and they just marry so well together, which is why even when I was on vacation, I was like, "Hey, I know Dr. Don is somewhere around here in Orlando. I need to find you and come visit." But when we were talking about putting this together, because really, if you want to turn your body and yourself into the ultimate performance machine, I mean, machine is kind of probably degrading to actually how amazing our bodies are, I think.
Right.
But we're going to cover everything from top to bottom, mentally, emotionally, physically, hormonally, and then sprinkle in some fun peptides and stem cells and anti-aging stuff and the stuff that I'm presenting, which we haven't even talked about, but that's all really interesting to really create the ultimate event where if you want to be able to transform and mentally and emotionally feel good for the next 100 years and physically feel good for the next 100 years, we're going to cover those topics for you.
That's awesome. And that's coming up in October, right?
Yes.
But if you want to come and learn from Dr. J and then obviously what we're doing as well, I think it'll be transformative, for your life. Well, thank you so much for your time and knowledge and expertise. We really appreciate it. I've learned a lot from just talking to you and being on the panel with you. So this is exciting. I'm looking forward to working with you on this retreat.
Yeah. I'm excited too. Thanks, Don.
If you want to get a hold of you, tell them anyway, just in case we'll have in the notes anyway.
So my podcast is called the Superhuman Entrepreneur Podcast, where we talk to entrepreneurs about how to, be successful in all parts of your life. It's not just about feeling good physically and building a big business, but then also you got to be able to show up for your family and for your spouse and for your kids and stuff. So we talk about all different aspects of entrepreneurship in my podcast. And then my medical practice is Unstoppable 365. So unstoppable365.com. They're the ones that we do the lab work through and do our coaching through and all the things.
Awesome. Thank you again for listening to another episode of You Must Be Out of Your Mind. And there it is.